Welcome back to Beyond the Surface, where we have real conversations about the struggles people face and about the hope that is beyond them. I'm Jean-Marie Olwage.
I am Quinton Mundell. We are both HPCSA registered counsellors, and today we are diving into the complex world of substance addictions.
Yes, so today we're going to talk about the many faces of substance addictions. Quinton, don't you sometimes find that this is one of those topics that people think they understand, but the more that one digs, the more complex it gets?
Most absolutely. People often think of alcohol and hard drugs when we say addiction, but in practice, we're dealing with a whole spectrum: prescription medication, nicotine, cannabis, performance-enhancing substances, even so-called legal highs.
Let's start with alcohol. It's still one of the most commonly abused substances worldwide, and I think it's often not really seen as being such a major problem because it's legal, it's socially acceptable, and it's very much woven into our culture, our celebrations, stress relief, and even networking. Sometimes it's work functions, there's alcohol freely available, and people don't often realize where it starts crossing over the line into dependency and possibly addiction.
Yeah, I think it's also so easy to come home after work and just have a drink, because many people see it as relaxation. So I think that is why it's so insidious, because when everyone around you is drinking, it's also harder to recognize when you've crossed that invisible line between social use and dependency.
I've seen clients who tell me that, I only drink on weekends. I don't drink every day. Often there's this misconception that someone who struggles with an alcohol problem drinks every day. But when we start to unpack it, it's perhaps binge drinking every weekend, or it's in large amounts that once they start drinking, they just can't stop. And then sometimes even the physical withdrawal, things like irritability or poor sleep during the week.
Yeah, so why do people binge drink? I see it quite a lot. Many people don't actually drink every day, but when they do, it's almost like they drink until they drop. Sometimes it even stretches over 2 or 3 days, and then what follows is usually extreme conflict with their partner. It's interesting because in those moments, their behavior and reactions can feel completely out of context, almost like a different version of themselves shows up. So I'm curious, what do you think drives people into that kind of binge drinking pattern?
I think maybe because in the week they've got their responsibilities like work, maybe raising children. The weekend is a good time just to sort of unpack and escape and to relieve from the stress before the next week starts again.
I also think a big part of it is that people don't necessarily want to deal with what's really going on. They don't want to sit with their emotions. Like with most addictions, drinking becomes an easy way to numb out and avoid facing what's underneath. What's interesting though is how differently it shows up. Some people binge drink, others start drinking early in the morning, and some only drink on weekends. But the underlying pattern is still about coping, or rather not coping. It's definitely a topic we could dive deeper into in our next episode, because it's fascinating how people's behavior is so closely tied to their drinking and more broadly their addictions.
And I think the mental side is huge because alcohol is often used to make them feel better, which it does initially. But I think a lot of people forget that alcohol is actually a depressant. So while you initially feel better, you actually feel more depressed afterwards. So physiologically, it's actually lowering your serotonin and it's disrupting your sleep cycles. And this over time can actually just make depression worse and anxiety worse.
And I also think a lot of people don't really consider what's happening in the body. The body doesn't actually care whether it's Friday or Monday. Over time, heavy drinking increases the risk of liver disease, high blood pressure, certain cancers, and of course mental health deterioration. But it's not just physical. Drinking has a huge impact on relationships and social dynamics. I've seen so many conflicts in couples where alcohol becomes the trigger. Often a couple won't talk about their emotions when they're sober, but once they've been drinking, everything comes spilling out. The problem is that the way it comes out is destructive. Arguments escalate, emotions get twisted, and instead of resolving issues, the drinking just fuels more chaos. And then there's isolation and shame that often follows. People hide their drinking or they feel ashamed of it, which pushes them further into secrecy and, ironically, often into more drinking. That's the thing about addiction. It doesn't just live in the body. It reshapes your whole life structure, the way you think, the way you feel, the way you behave, and the way you relate to others. It really affects every layer of a person's life.
I think especially if alcohol starts causing blackouts or times that you can't remember what you've done or what you've perhaps said, and it starts impacting your relationships close to you. Don't you find it's often the spouse or a family member who first starts noticing that alcohol is perhaps becoming a problem?
Yes, definitely. But it's like other people maybe notice it's a problem, but a person doesn't necessarily want to take accountability. They can always justify it. Many times they can justify why they do what they do, and then they can just keep doing it because they're not willing necessarily to let go of the addiction. Therefore, they're going to justification.
This is particularly concerning when someone is still managing to hold down a job and maintain their home life. The impact might not seem severe yet, which can make it easier to deny the problem. However, this functional facade often masks a growing dependency. But let's shift our focus now to discuss other substances.
Things that we think of in terms of addiction, things like heroin, methamphetamine, cocaine, the psychological and physical dependency is there often faster and a lot more dangerous.
I also think the stigma is much stronger, which means people might avoid seeking help until the addiction is advanced. For example, with heroin, the withdrawal symptoms can be so intense. People experience muscle pain, vomiting, anxiety, and that is the reason why people keep using, just to avoid feeling sick.
And not using to get high anymore, they're actually just using to be able to still function. And I think that's often why people feel why they're still using, why don't they just stop without realizing, but it's incredibly hard for them just to stop. They need it to just function. And I think meth is another big one. Beyond just the physical harm that it causes, it has severe cognitive effects. Things like memory loss, paranoia, mood swings. I've even had a client who described meth addiction as living on borrowed time.
I've also worked with a few clients who've shared that they use meth during sex, and what they describe is that it activates their senses in such an extreme way. Even something simple like drinking a glass of water can feel like every vibration is amplified. What I've also heard is that it can create such a heightened state of arousal that they become extremely hypersexual, to the point where it's not about connection anymore, but purely about chasing sensation. And that is where it can get very toxic. For some, it doesn't matter who the partner is, or even how many partners there are. The drug drives the behavior, not the person's actual values or boundaries. I've also had clients say that they can go without sleep for days, spending hours in sexual activity, and then crashing hard afterwards with shame, paranoia, or even physical pain. For others, it becomes tied to risk-taking, unprotected sex, unsafe environments, or partners they normally wouldn't have chosen if they were sober. So while the immediate experience can feel euphoric or almost superhuman, the long-term impact is often really damaging to their body, their relationships, and their sense of self. Another addiction that is very common is cocaine. Which makes it especially tricky is that the psychological addiction is incredibly strong. It gives this intense rush of euphoria, confidence, and energy. So even the high is great, the high fades actually quickly. And because the high fades quickly, that is what drives people to use it again and again. And this cycle then automatically puts a high strain on the heart, and it raises the risk of overdose.
What's interesting is how often cocaine use shows up in the corporate world. I've seen people turn to it because it helps them to stay awake, sharp, and hyper-focused. They feel like they can push harder, work longer hours, and get more done. But very quickly it shifts from a boost to a dependency. They need it just to function and to keep up with the performance demands. There's also a very strong link between cocaine and sex. Many people describe sex on cocaine as more intense, more stimulating, even making them feel invisible. The problem is that the recovery can then feel extremely difficult because normal intimacy without a drug feels flat or unsatisfying compared to that heightened experience. One of my clients once described cocaine as a God drug. He said, "When I use it, I feel like I'm God. I can do anything, achieve anything." And while that might feel empowering in the moment, it often leads to arrogance, risky behavior, and eventually a breakdown when the body and mind can't keep up anymore. The bigger picture here is that cocaine doesn't just create a chemical dependency. It rewires someone's relationship with work, sex, confidence, and even their identity. That's why it's such a powerful but also destructive substance.
I think that cocaine also can make you just feel absolutely invincible. And combined then with sex as well, going into recovery, it's very difficult to get used to a new normal without that. I think we've often got this misconception, especially when it comes to illicit drugs, that it's somebody who's on the street that uses it. We forget that addiction can infiltrate any aspect of society, your executives, as you mentioned, it can be your athletes. It's not always the person who's necessarily hit their rock bottom. I think another addiction that's often missed is dependency on prescription drugs. Things like opioids, sedatives, stimulants. It often begins in a medical context. It's prescribed. It's seen as being safe.
Yes, and someone might get pain medication after surgery or sleeping tablets during a stressful period, and it works until they can't cope without it. And now the brain starts to adapt, and tolerance builds, and suddenly the prescribed dose just isn't enough. It's easy to justify prescription drugs because my name is on it, I got it from the chemist, or it's over the counter. And I think it's harder to realize that I'm actually addicted,
as it's easily accessible.
I know of clients that actually go from one doctor to the other doctor for prescription medication, and they go from one chemist to the other chemist. They do realize they have a problem.
I think you're so right. The danger can feel far less real because it's being prescribed. It's maybe for a legitimate reason to start off with. But if you start taking it for longer than it's intended, you can still overdose, you can still start causing organ damage, and dependency can quickly build.
Exactly. And stimulant misuse like ADHD medication can lead to insomnia, anxiety, heart issues, especially if taken without medical needs.
I think another very prominent addiction that we face in our society is a nicotine addiction. And nicotine addiction is still one of the hardest habits to break. Back in the day, you remember all the adverts where the smokers were surfing, were on yachts. They all looked glamorous and young and fantastic. But we've realized over the years the damage that it can actually start causing. So things like cigarettes, vaping, even smokeless tobacco, they all tap into the same dopamine pathways.
And I think nicotine withdrawal symptoms create restlessness, irritability, brain fog, can make quitting feel impossible. The long-term health benefits of quitting are enormous. Reduced cancer risk, better lung function, improved circulation.
I can remember from my nursing days when I used to work in ICU, watching some of the patients withdraw from nicotine. And that's, I think, when I started realizing how much of a physical dependency it actually can be. And cannabis is also an interesting one, especially with the change in laws here in South Africa. Some people use it medicinally, others recreationally. And while not everyone develops an addiction, heavy use can definitely lead to dependency, motivation loss, and even cognitive impairment.
I see quite a lot of people who use cannabis really struggling to achieve their goals, or even to hold a clear vision, or where they want to go in their lives. For many of them, motivation becomes a major battle. Focus and concentration are often affected too. And that sense of drive, that push to move forward, gets blunted. Now, that doesn't mean cannabis has the same effect on everyone. For some people, it can feel relaxing, grounding, or even medicinal. But for many of the clients I work with, especially those using it daily, it often shows up as procrastination and lack of follow through, or feeling like life is just happening to them rather than them actively shaping it. What's also important to recognize is that cannabis isn't just a casual lifestyle choice for everyone. For people with certain mental health conditions, it can have much more serious impact. Schizophrenia is a good example. Research has shown that heavy cannabis use, particularly strains high in THC, can create symptoms like paranoia, delusional thinking, and disorganized thoughts. In fact, for some vulnerable individuals, cannabis use may even increase the risk of developing psychotic disorders earlier or more severely than they otherwise would have had. And then when cannabis is paired with nicotine, which is how many people consume it, rolled into joints or blunts, the effects compound. Not only does the nicotine create its own cycle of dependency, but the combination seems to hit the brain's reward system even harder. What I often see in practice is that this pairing locks people into a cycle where their sense of balance, clarity, and mental well-being is really compromised. So I think it's worth saying cannabis is not always the harmless, laid-back substance it's often marketed as. For some, yes, it can be used with intention, but for others, especially those with underlying mental health vulnerabilities, it can be deeply disruptive, not only to their goals and vision for their life, but to their mental stability.
And I think that's dangerous because you don't always know if you've got a predisposition for something like schizophrenia. And cannabis use is one of those things where it won't necessarily bring it out during the first time you use it, but you could be smoking it for years and all of a sudden you can end up with paranoia and get stuck there.
I've also worked with clients where cannabis or other drugs seem to trigger something much bigger beneath the surface. One young man I think of was actually head boy at a school, really bright, driven and full of potential. But after using, he developed schizophrenia. And from that point on, his whole life changed. What struck me was how suddenly it all shifted. It was as if something got triggered in his mind and he could never really return to what most of us would call normal again. That's the difficult reality. For some people, especially if there's a genetic or biological vulnerability, substance use can act like a match being struck in dry grass. It lights up something that was already there but hidden, and it completely alters the course of a person's life, which is so sad.
I think another dangerous territory that is also overlooked sometimes is anabolic steroids and similar enhancers that people used. Often it isn't brought up in addiction conversation.
I think everyday gym goers can easily get caught up in body image. There's so much pressure, not just from social media, but also from the culture inside gyms themselves. People start comparing, and that comparison often turns into dissatisfaction with their own body. That's where steroids sometimes come in. The temptation is strong. They promise faster muscle growth, quicker results, and the kind of body that gets admired. But what many don't realize is that it's not just a shortcut, it can become a dangerous cycle. Physically, steroids can damage the liver, heart, and hormones. Psychologically, they can feed obsession, aggression, and even depression when someone comes off them. What I noticed too is that it often begins innocently. Someone just wants to improve their physique, but then the compliment starts. They're getting attention and compliments from others, from other people maybe they never would have gotten before. And now their identity gets tied and attached to this bigger body. But before long, they rely on steroids to maintain that image. It's not just about muscles anymore, it becomes about self-worth. And once that loop is in place, it can be very hard to break.
It gives a quick fix, Other people need to get results, takes them years. I can use the steroids and I can get the same results in months. So I can do less and get more. And I think that is many times what people is after. We as human beings is actually quite lazy. So we're always looking for a quick fix, the easy way.
Instant gratification. Absolutely, especially someone struggling with their body image and self-esteem. But I think we forget about the physical risks that come along with using things like steroids and things like liver damage, heart disease, infertility, and not to mention the psychological things of maybe even worse body dysmorphia, where you just feel like you never are big enough, strong enough, good looking enough, the aggression that comes with it often, and then ultimately the depression can all be really harmful.
I've also worked with a client who was really battling with this intense aggression, and it became clear that steroids were playing a very big role. There's even a term for it, roid rage, because steroids can disrupt brain chemistry, increase testosterone, and heighten irritability and anger. What was even more concerning with this client was that he already had heart problems, and steroids are well known to put extra strain on the heart, raising blood pressure, thickening the blood, and increasing the risk of heart attacks. Yet, despite knowing this, he couldn't stop. His attachment to his body image, his strength, and the way he looked was stronger than his concern for his health. And I think that's the scary part. It shows how important the psychological grip of steroids can be. It's not just about building muscle. It becomes an identity. The body becomes a symbol of confidence, dominance, even self-worth. Letting go of steroids for many feels like letting go of who they are. That's why it's so difficult to break free, even in the face of serious health risks.
We've discussed now quite a lot of addictions here, and I think across all these addictions, the recovery process isn't linear. It's different for every individual, and it's different with every drug. And I think we just need to remember that relapse doesn't mean failure. It's feedback that something in the plan needs adjusting.
Well, I think it's incredibly difficult and takes a lot of courage to admit maybe that something is reaching dependency level or even addiction level already. The earlier that people reach out, the better the outcomes. So going for counseling, rehab programs, support groups, or even medical interventions can all play a crucial role.
Yeah, I think it's so important to have awareness, because the moment if you have awareness, you're aware, okay, I'm actually having a struggle, and you can start to change it. But I think people don't actually give it attention. They just hope it's going to disappear. They hope they will get over it. And then they don't. They actually get into a big pit, a hole, and then they need to get out of that hole, which then becomes extremely difficult. I always remind clients that addiction thrives in secrecy, and speaking out is the first step in breaking the silence.
You can't change what you don't acknowledge. So that first step is actually just being able to say, I think this could be a problem, or that I have maybe an addiction and I need help for it. That compassion for yourself is so crucial. But I think shame, as you've mentioned, is sometimes the biggest barrier to change.
I think shame is a really big emotion, and it definitely goes hand in hand with addiction. Just saying I'm battling with addiction already creates shame. And I think many people feel that. When you see yourself as an addict, it can feel like I'm out of control. Something else is controlling me. I'm powerless. And that very experience, that loss of control, creates even more shame.
What I've seen is that shame always creates a lack of self-esteem, a lack of self-worth. And now it actually influences yourself, how you look at yourself and how you actually see yourself in this world.
I mean, I often mention in my sessions, I think there's a big difference between conviction and condemnation. So conviction is realizing that something I'm doing is causing harm or isn't something I should be doing, but it spurs me into action to change it. Whereas condemnation is when you start down that rabbit hole of I'm so bad, I'm never going to win this, I'm not worth more than this, and it actually puts you into a further depression and takes away that courage to take the action.
Right.
So listeners may be wondering today, well, we haven't mentioned other addictions such as pornography or gaming or gambling addiction, but we will be looking at those on a separate podcast. But I really want to mention that if today's episode has resonated with you or you're concerned about a loved one, please reach out to a registered professional or a helpline. And remember, you're not alone in this.
Thanks for joining us for this podcast Behind the Surface. We'll see you next time, where we will be exploring the topic of cross addiction, how one addiction can morph into another.